Which of the following tubes should be collected first in the order of draw? A. Light blue. B. Red. C. Lavender. D. Green. Answer A. The light blue tube, which contains sodium citrate, must be drawn first to avoid contamination and maintain accurate coagulation test results. What is the appropriate action if a phlebotomist punctures an artery during venipuncture? A. Apply heat to the site. B. Ask the patient to apply pressure. C. Apply pressure for at least 5 minutes and notify the provider. D. Proceed to collect the specimen. Answer C. Arterial puncture can lead to significant bleeding. Apply firm pressure for at least 5 minutes and inform the provider immediately. Which of the following conditions would most likely cause hemoconcentration during phlebotomy? A. Tourniquet applied for over 1 minute. B. Using a butterfly needle. C. Collecting from a sclerosed vein. D. Patient in a fasting state. Answer A. Leaving the tourniquet on too long causes pooling of blood, concentrating cells and affecting test accuracy. What is the correct angle for needle insertion during a routine venipuncture? A. 15 to 30 degrees. B. 45 to 60 degrees. C. 5 to 10 degrees. D. 75 to 90 degrees. Answer A. The recommended angle for venipuncture is 15 to 30 degrees to properly access the vein and reduce injury. Which additive is found in the gray top collection tube? A. Sodium heparin. B. Potassium oxalate and sodium fluoride. C. EDTA. D. Sodium citrate. Answer B. Gray top tubes contain potassium oxalate and sodium fluoride used for glucose and alcohol testing. Which of the following errors can cause a falsely elevated potassium level in a blood sample? A. Using a small gauge needle. B. Allowing the tube to clot. C. Incomplete clotting before centrifugation. D. Hemolysis due to rough handling. Answer D. Hemolysis causes red blood cells to rupture, releasing intracellular potassium and falsely elevating levels. A phlebotomist should identify that which of the following sites is contraindicated for venipuncture. A. Arm within 4 running. B. Antecubital vein. C. Dorsal hand vein. D. Median cubital vein. Answer A. Blood should not be drawn from an arm with an active 4 due to potential contamination and inaccurate results. During capillary collection, what is the correct order of draw? A. EDTA, other additives, serum. B. Serum, EDTA, other additives. C. Sodium citrate, serum, heparin. D. Heparin, serum, EDTA. Answer A. In capillary draws, EDTA is collected first to minimize platelet clumping and ensure accurate CBC results. Which of the following veins is most commonly used for venipuncture? A. Basilic. B. Median cubital. C. Cephalic. D. Dorsal metacarpal. Answer B. The median cubital vein is preferred due to its size, stability, and location. Which complication is most likely if a phlebotomist performs a venipuncture on the basilic vein? A. Excessive bleeding. B. Nerve injury. C. Hemoconcentration. D. Contaminated specimen. Answer B. The basilic vein is near major arteries and nerves, increasing the risk of injury during venipuncture. Which action should a phlebotomist take when collecting blood cultures? A. Use a tourniquet below the intended site. B. Clean the site with alcohol only. C. Perform the collection before antibiotic therapy. D. Invert tubes immediately after draw. Answer C. Blood cultures must be drawn before antibiotics are administered to avoid false negative results. What is the maximum depth for a heel stick on an infant? A. 2.0 mm. B. 2.5 mm. C. 3.0 millimeters. D. 1 millimeter. Answer A. The maximum depth for a heel stick is 2.0 millimeters to prevent injury to underlying bone or tissue. When should a phlebotomist label blood collection tubes? A. Before collection. B. After leaving the room. C. Immediately after collection in front of the patient. D. While the blood is being drawn. Answer C. Tubes should be labeled in the patient's presence immediately after collection to ensure proper identification. Which of the following is an appropriate cleansing agent for skin before a blood alcohol test? A. Isopropyl alcohol. B. Povidone iodine. C. Hydrogen peroxide. D. Acetone. Answer B. Alcohol-based cleansers may interfere with results. Povidone iodine is preferred for alcohol testing. What is the recommended method for collecting a specimen for a PKU test on an infant? A. Venipuncture of the cephalic vein. B. Capillary collection from the heel. C. Capillary collection from the finger. D. Dorsal hand vein draw. Answer B. A heel stick is used to collect capillary blood for newborn screening, including the PKU test. Which of the following specimens requires chilling during transportation? A. CBC. B. Bilirubin. C. Lactic acid. D. Blood culture. Answer C. Lactic acid levels are temperature sensitive and must be transported on ice. Which of the following is a sign of syncope during venipuncture? A. Flushed face. B. Shallow breathing. C. Diaphoresis and paleness. D. High blood pressure. Answer C. Fainting is often preceded by sweating, pale skin, and a dazed expression. How many times should a red top tube be inverted after collection? A. 0. B. 5. C. 8. D. 10. Answer A. Red top tubes contain no additive and do not need to be inverted. What should a phlebotomist do if they notice a hematoma forming during a draw? A. Apply a warm compress. B. Stop the draw immediately and apply pressure. C. Finish the draw as quickly as possible. D. Draw from above the hematoma. Answer B. The draw must be stopped and firm pressure applied to prevent further bleeding. Which of the following tubes is used for a prothrombin time test? A. Lavender. B. Light blue. C. Green. D. Gray. Answer B. The light blue tube contains sodium citrate, used for coagulation tests like PT. A phlebotomist prepares to collect blood from a patient with a left mastectomy. Which site is appropriate? A. Left antecubital fossa. B. Left dorsal hand. C. Right arm. D. Use the foot without provider approval. Answer C. Blood should not be collected from the site of a mastectomy due to risk of lymphedema. Use the opposite arm. Which tube should a phlebotomist use to collect a specimen for serum chemistry testing? A. Lavender. B. Light blue. C. Red or gold. D. Gray. Answer C. Red or gold SST tubes are used for serum chemistry testing. What is the correct response if a patient refuses a blood draw? A. Restrain the patient. B. Leave and document the refusal. C. Call security. D. Draw the blood anyway. Answer B. Patients have the right to refuse. Document the refusal and inform the provider. A phlebotomist accidentally sticks themselves with a used needle. What should they do first? A. Discard the needle in the sharps container. B. Report the incident to the supervisor. C. Wash the area with soap and water. D. Document the incident. Answer C. Immediate first aid is washing the site with soap and water, then reporting the incident. Which of the following situations requires contact precautions? A. Tuberculosis. B. Influenza. C. MRSA wound infection. D. Measles. Answer: C. MRSA, especially when transmitted via wound drainage or contact, requires contact precautions.